Do you ever feel that life is just way too overwhelming?
Do you ever feel like life just gets in the way?
Or how everyone else makes it look so easy and you just can't figure it out?
All the time. And if this sounds like you, then grab a seat, get a cup of Joe or a glass of Merlot, and join the two broads from Boca as we discuss life and those taboo topics that you only talk about behind closed doors.
It is time to open those doors, embrace yourself, and take your power back.
So give us a call at 888-565-1470 and ask those unspoken questions.
Or simply just share an idea.
Two broads from Boca, and we are here live. I want you to all know Dawn has inspired me to show a little arm.
Well, hello and good evening.
Yes.
Sounds like we're not two broads from Boca. It sounds like we're having an evening rendezvous.
We are having an evening rendezvous. I am Dr. Amy Schreibman, and this is my co-host,
Dawn Grauer. Welcome to Two Broads from Boca.
And how are you?
We have big news tonight.
We
you want to
do.
share the big news?
We are FM.
FM!
We are finally FM, 95.3 WWNN FM.
We've been talking about it, and finally,
The switch was flipped.
our switch
It's
was
a gorgeous
flipped. We
thing.
are FM. Our engineer is here. He's making sure we stay live. That adds another 1.5 million of you fabulous listeners joining us.
Fab.
Joining us. So we're FM. We reach from Hollywood to Boynton Beach. Our AM goes from Miami all the way up.
Yeah.
And of course, you're live streaming right here on Facebook, Two Broads from Boca, and on our website,
That's correct.
twobroadsfromboca.com.
And on Facebook, they see us all over the country. Isn't it amazing? We go everywhere.
We're international on
We are
Facebook. We are
international.
everywhere.
We are.
How was your week?
My week was fabulous. My week was not really. No, my week was really good. Nothing really was going on. Just typical mom stuff.
Elections?
We have a new president,
We do.
and that's all we're going to say.
It is what it is.
And you know what? We have to just move forward. No one here is saying that they're for President Trump or against President Trump, but we're here and we're all Americans, and we should be proud of that.
We are non-political.
We are non-political.
We're non-political. Just be kind to one another.
We're Americans.
Support each other. We're all
Exactly.
Americans. It will be what it will be.
That's it.
We are here to support each other and move forward. Whoever won, we would say the same thing.
That's correct. So guess what? Just rock on, America. That's all.
So we have a fabulous guest,
We
but
do.
before we introduce him, I have to tell you that I went for my annual exam today to my GYN,
Sid.
and the rest will remain, HIPAA violations. However, big topic of conversation in her office and at the gym.
The vagina.
We need a third segment of the Vagina Chronicles.
See, do I not know?
She knows,
I
so
know.
we will leave you hanging with when it will be and who our guest will be.
We will revisit the vagina monocle.
But I'm telling you, the Mona
Chronicles.
Lisa, now I call it the flower pot, they call it the garage. Everyone's
The
laughing.
garage. I don't care
But
for the
we're all
garage.
talking about the same thing.
No, I don't
So
like
stay
a garage.
tuned. That will be coming up hopefully in December.
I like the flower pot, but I do not like a garage.
That's what I'm thinking.
No, that's dirty and messy. No, thanks.
Oh, we won't go there. Anyway,
Yeah.
we have a fabulous guest with us tonight, Dr. Ezra Berkowitz of Orthopedic Center of Palm Beach County.
That's correct.
And we thank Orthopedic Center, OCPBC as I call it for short, which makes it so much easier, as one of our big sponsors
Say
for Two
that
Broads
3
from
times
Boca.
fast.
So welcome, Dr. Berkowitz.
Yes.
Thank you for having me.
We'll just have you talking to the mic, and we're going to have some fun.
All right.
There you go.
Thanks for having me on your FM debut. That's exciting.
Yes, that's
Exactly.
true. Your
How about
FM
that?
debut. That's really cool.
So if you ever give up your day job, you have a perfect segue into radio,
There you go.
your FM debut.
Your FM debut. So tell us, you are a pediatric orthopedic surgeon.
Yep.
But that doesn't only mean that you operate.
Correct. In fact, these days I spend most of my time in the office. I do a fair amount of surgery, but I try to manage many things conservatively without surgery, so I try my best to keep myself and the kids out of the OR.
There you go. I like that approach. Now, you see from infants all the way through the age of 18, correct?
Yep. I see newborns from, on occasion, the day they're born, all the way up to 18. And, of course, I'm in a large group that treats adults as well. And sometimes we help each other out. And I've seen adults as old as 100 within the past few years.
Wow.
Just a big baby, honestly.
Exactly.
I call your
it's the
group
other
from
end.
pediatrics to geriatrics. That's kind of how it goes in our house.
Yeah, I
As
think-
you know, just like your office.
Exactly. I think they say that kids are not just big adults, but I certainly feel that adults are really just big kids.
I was going to
agree.
say it's actually in reverse, and it happens over and over again.
Yep.
What would you see a child for at birth?
For me, for birth, there's a number of things that happen in the newborn orthopedically. Two things come to mind right away. One is that we see often children with clavicle fractures, which can be from a birth trauma. And on occasion, it really freaks people out. But I like to see it, actually. And I'll tell you why is because most often if the clavicle is fractured, that child's not going to have a difficulty with their brachial plexus. This thing called shoulder dystocia that kids can get sometimes with a difficult birth or traveling through a small birth canal can result in injury to the shoulder and to the brachial plexus. Right. And often, if the clavicle breaks, it sounds horrible, but it actually can sometimes ease the birthing process. And those clavicles heal. They heal very fast. They heal in like 2-3 weeks, and almost never do they have difficulties or complications. Now, of course, you never say never. Sometimes they can have other things, but the clavicle fractures at that age, they heal so fast.
How do you cast it? Do you splint? I'm not a splint, but sling? How do you do something?
Usually a little tiny one like that. First of all, you're going to be so careful and easy with them that you almost don't have to, tell the parents or do anything special, but you just keep the arm wrapped against the body and that's it. So we use a little ace wrap, or sometimes you could put one of their cute little...
It's just a tighter swaddle.
Do you see a lot of hip dysplasia? With the
right, and that's the other thing that comes to mind, and that is a very common thing, and hip dysplasia is one of the things that we, as pediatric orthopedic surgeons, treat very often, and thankfully...
And what is hip dysplasia?
Sure, of course. So thankfully, as I was going to say, it is not that it's less common, but it's much more frequent that we can find it in this day and age, and so hip dysplasia is simply that every now and then the hips don't develop into a proper socket the way that they should. And, it's a very common thing. It may even be a variant of normal, but sometimes girls a little more than boys, sometimes a tighter package rather than a looser package. So
They're wrapped up in a really nice little tight package.
Sometimes first-time mothers or twins, it may be a little bit higher risk factor, but sometimes if the hips are not pointed directly where they're supposed to, then that socket doesn't form as well on the ball and socket. The hip is a ball and socket joint, and the socket may not form as nice and round. And if it doesn't, then the ball kind of gets away from it. It kind of gets out, and then if that gets out, then the socket doesn't form even worse. And sometimes they can actually dislocate. And
you make it sound so easy. I'm visualizing a textbook. There's the ball and the socket, and we just fix it.
Yeah, well,
that's the beautiful thing is you can just hopefully fix it.
Yep, and at that age, in this day and age, in fact, we start treating kids before they're born. We see kids in utero on ultrasound if they are in danger. Of course, there's not really much to be done, but it's very important to recognize it, and you can really influence that baby when they're first birthed. I mean, when they come out, you can help to really just point the ball towards the socket, and that's what almost always solves the problem.
Wow.
And,
give us a call. I just want so people can call and ask you questions.
Of course.
Ask Dr. Berkowitz any questions, 888-565-1470. And this way you can ask any questions directly to Dr. Berkowitz. So I'm sorry, continue.
No, it's okay. This is a good example of things that I'll be able to start treating or manage early on. And it's one of those things where the earlier we treat it, the better.
Sure.
And if we recognize it early, we can really solve the whole problem by directing the hip inwards. And that's the easiest thing to do. You just have to keep the legs up and out. You keep the kid
kind of like a frog.
It sounds like going to the GYN. Just keep your legs up and out. Right? And there you go.
Yeah,
and we digress.
I haven't had that. But there are some cultures where hip dysplasia is very common. And in those cultures, it's probably influenced by the fact that they keep the legs wrapped and swaddled real tight down and in. And they have a very high risk of hip dysplasia. Right. And in cultures where they routinely carry their babies with the legs apart, it's a good deal. They have very.
So that happens in birth, and then we go forward into the toddler years.
I will tell you, I remember when my son was 2, and he decided to jump off the bed, and then he jumped off the bed onto the floor, and the next thing I know, his right leg is up, and he's like, I can't walk.
They're always jumping out of, not always, but when they first jump out of their crib and you put them back and say it's not going to happen again, and they jump out of their crib again.
Yeah.
Do you see a lot of that?
Cribs have a special
place in your
place
practice,
in my heart. There's special cribs they have at the hospital that actually have like a roof, so it's really
cage.
more of a cage. And
Yeah.
I always joke with my wife at home. I wish we had that cage.
cage.
Love the cage.
But it is true though. Sometimes kids can get their legs stuck in the slats of the crib, and those kids can fracture just by if they fall or they get their legs stuck. But I think what you're describing sounds like more of what we call a toddler's fracture.
That was it.
Toddlers break their legs very easily with just a short fall, or we often see it from a slide. So it's the daddy carrying the baby on a slide, and then the leg can kind of
Crack.
just get stuck, and it just takes a little bit of rotational energy, and it cracks. And they're often fine. These kids are so tough. They
know,
get
they're
up, they
resilient.
bounce, but they just not wanting to put weight on it, and that's how you know. And sometimes we get them in the office, and I take an X-ray, and sometimes I don't see anything. But if they don't want to put weight on it, then I'm presuming there's a break. And then 2 weeks later, 3 weeks later, we see some healing of the bone, and we knew it was a fracture.
Right.
My son made many a visit to Dr. Ratty before you were at OCPBC.
Yeah.
And Dr. Cohen, between basketball and football and you name it, every Sunday we were on the phone with Dr. Cohen or we were on the phone with Dr. Ratty, and we were there.
Yep. Yeah, it's kids are. I get asked very often if a parent's child has weaker bones or if there's an issue with nutrition. And of course, I love to talk about nutrition, and I do love to counsel my patients on proper nutrition,
Really?
et cetera.
That's awesome.
But most of the time, it's just that kids are very active. They're very active beings, and we love for them to be active. So
Absolutely.
we encourage them, and they just get themselves in compromising
You
situations.
can just roll them in that bubble wrap.
I've offered it.
Have you thought about that?
I have
offered
a
it.
question. Because you deal with kids, obviously there's sports injuries that are involved. Now, it's been a trend lately that we're seeing as young as 11 kids having the Tommy John surgery.
Yes, there's a trend these days of many surgeries being done that we typically associate with an adult pattern of
Right.
injury, and I think that trend has been discussed at our conferences and of course even on the national circuit. And it's most likely that at younger and younger ages the kids are getting more involved with organized sports. I mean, and we love our kids to be in organized sports, but we start doing it at age 3 and age 4, and so. The more they're doing that, the more often they're at risk for this type of an injury. And the other thing is that, and more particularly with elbows in baseball, is the fact that children are choosing one sport and they're playing it all year round.
Yep.
And
Constant use of whatever it is.
In the old days, kind of a guy, but of course the older people always say, well, in the old days we did a different sport every quarter, and I was a 4-star athlete and I did 4 different things. They didn't offer baseball all
Right.
year round. And so it's true, cross training is good for you, or it's good for the way that you play your sport.
Sure.
And not cross training can be bad for you. So we always try to encourage athletes to take time off or take a season off or things like that, because if you do the same pattern of the same things over and over again, something's got to give, as they say. And what we do is often just tell patients to rest, and that's all they need to do. But I try to encourage kids to get involved in different sports at different times of the year. And I grew up in New York. In New York, we had winter.
Yeah. So you couldn't do anything.
And we did winter sports.
Hold that thought
We're
one
gonna
more
take a
time.
break.
We're going to take a break. Give us a call, 888-565-1470. We'll come back with Dr. Berkowitz from OCPBC and talk about nutrition, taking a break, and some rest. Know your body, gain control of your health, transform your life. If your body could talk, what would it tell you? At DexaFit, we show you how to take control of your health and fitness to live a happier, more fulfilling life. Hormones, metabolic health, and cardio fitness all play a significant role in your energy levels, sleep quality, and overall well-being. With our proven methods of measure, track, and discover, we show you how your body composition, cardio fitness, and metabolic health compare to your optimal level. At DexaFit, our goal is to help you identify and understand the health and fitness of how to transform your body to meet your individual goals, break through your plateaus, and take the guesswork out. Improve your energy levels, sleep, and weight. Give us a call at 561-923-8833. We are conveniently located at 2499 Glades Road in Boca Raton. Schedule an appointment online at DexaFit.com. Give us a call 561-923-8833 and mention this ad for special pricing.
This portion of our show has been sponsored by Edelman, Barron, and Schreibman, MD-PA, board-certified physicians in pulmonary, critical care, and sleep medicine. Offices are conveniently located in Boca Raton and Delray Beach, Florida. 561-488-2988.
From simple sprains to highly complex surgeries, the Orthopedic Center of Palm Beach County has been serving the South Florida community for over 65 years with the finest orthopedic and pediatric care. Our physicians are each experts in their field, providing a complete spectrum of musculoskeletal care from prevention and diagnosis to treatment and rehabilitation for every part of the body in both children and adults. Our doctors are able to perform the most advanced treatment options available, including PRP therapy, stem cell, arthroscopic surgery, and microsurgery. At the Orthopedic Center of Palm Beach County, we are dedicated to providing a comprehensive solution to get you back to your routine as quickly as possible, in the shortest period of time with the least amount of inconvenience. With 3 beautiful new offices located in Lake Worth, Boynton Beach, and Wellington, we are able to provide much-needed care to families in the South Florida area. Give us a call at 561-967-6500. From our experienced physicians to the most advanced treatment options to our state-of-the-art facilities and excellent support staff, the Orthopedic Center of Palm Beach County is committed to providing you with the very best care. Call us at 561-967-6500 or find us at www.ocpbc.com.
Hey, grab your glass of Merlot.
Or your cup of coffee. And if you want to join in on the fun, give us a call at 888-565-1470.
Let's rejoin the two broads from Boca. Welcome back. We are the two broads from Boca. We are live tonight with Dr. Ezra Berkowitz, orthopedic pediatric surgeon from Orthopedic Center of Palm Beach County. Wow, what a mouthful. We are FM. He is our FM debut, 95.3 WWNN FM. Love those call letters. Of course, 1470 AM. Give us a call, 1-888-565-1470. We were talking about sports injuries and taking a rest.
Right.
How do you even present that to a parent? Because all of our children are so incredibly gifted in sports.
Yep.
How do you say, you know what? I think it's time they need to rest. Whatever sport it is that they're playing.
Yeah.
Time to stay back a little.
Well, that's hard for me too. I mean, I think that, first of all, I think kids should be active, and it's really great for them to be out there. And I have almost as many kids that don't do enough as I do that do too much.
Of course.
But the kids that do too much are in my office a lot. And most of the time they're there is because they're just doing too much. And the only answer to that is really rest. And so I almost, I try to approach it. I don't like to be a confrontational guy. I try to allow the body to tell them what to do. And often when they make it to my office, that's the point that they're at, where something hurts too much, you've got to stop.
It's a sign to stop.
And that sign to stop is not a bad sign. It's the body telling you what to do. And when the body's giving you a message, then all you've got to do is listen. And most of the time, resting is the only thing you can do. There's lots of surgeries that we can make for things, and most of the time surgery is going to put you out a few weeks, and guess what? That's rest. And then you build up again and you return. But the idea is most of the kids I treat are young, they're healthy, and their bodies have what's inside them to kind of get better. All they need to do is give it a little bit of time and then ease their way back in without trying to overdo it again.
And another big thing for kids, and as a nurse, and you see a lot of it, nurse practitioner, scoliosis.
Mm-hmm.
I'm so out of that scoliosis bubble, but I remember always, the kids being screened. Even as a kid, I had a very good friend who wore that cage.
Yeah, that's the
you treat
Milwaukee
scoliosis?
race. Yes, I do. I do see and treat many patients with scoliosis. Scoliosis is actually a very common thing. Maybe 3% or even 5% of the population. It's something that runs in families. It's something that is often related to growth. And, there's a lot of different types of scoliosis. There's certainly the kind that's from birth, and that may have to do with malformations of the vertebrae. And these are much less common. And, of course, kids that have neuromuscular issues like tightness and CP, they will sometimes develop a scoliosis as well. But the most common is the idiopathic version. And idiopathic means that we're idiots. We just don't know know
Exactly.
what
Don't know where it came
Where
from.
we don't know
curve.
what's causing it, and that is the most common version. And most people think that it's the growth, whether it's growing one side more than another or the front more than the back, and you can develop a curve. And a little mild curve is nothing. I mean, I don't want to say nothing, but it's something that doesn't generally cause a lot of harm or difficulty or disability later in life, and that's what we're on the lookout for.
How do you find conservative treatment?
Well, I manage, I'm really doing strictly conservative management for scoliosis now. And the idea is, just as you mentioned, to try to pick it up early. If you can find these kids early and start dealing with them early, then we can
Early
do,
intervention.
specific types of therapy, and we can do bracing. And bracing is, as you mentioned, it sounds like torture. But these days we don't use a big metal cage or brace. We use more of a foam than plastic. There's even braces they make now that are soft with straps. I prefer the plastic one because I think the rigidity really helps. And the idea is prevention. The idea is we're not trying to straighten you out. It's that we're really trying to prevent it from getting worse. And it has about an 80% effectiveness rate if it's done at the right time for the right curve. And it's more effective in girls, but this scoliosis is more common in female patients than it is in males. I think the males just don't wear their brace, and so they
It's that
probably
compliance thing.
right. And so compliance, with good compliance, the bad curves, the severe curves that really do sometimes require
surgery.
or should have surgery, can be prevented. And so if you pick up a curve that's in the 20-degree range, which sounds pretty bad, but it's really not, and you get a brace on that patient and they wear it, you can really stop that curve from
How often
turning.
do they have to wear it, and do they wear it all the time?
Well,
Even at rest?
I like a night brace. There are many people that believe in a day brace, but they're really both about as effective as long as it's worn enough. And a night brace needs to be worn at least 8 hours, maybe 10 hours. And there's some proof that maybe 12 hours is better
Okay.
if you're sleeping that much. And I
I was
think
going to say, who's sleeping that much?
teenagers.
Not us.
2
Well, the
hours.
thing is, teenagers do sleep a lot, and
True.
and
They
when
do.
teenagers sleep, it's not because they're texting their friends for too much. It's because they're growing,
Right, I was
and
just
and
gonna
they
Is there
need
an
that
age
sleep.
that you want to start screening them?
We
Well,
11. I mean,
yeah. But every
11.
pediatric is it that this one
Every
should be
pediatrician
assessed.
should be doing scoliosis screening almost every time they see their kids, and of course, the early ages to look for the congenital ones. But
Right.
after 7 or 8, we need to be monitoring. Some of girls are approaching their peak height velocity or their growth curves as early as 9, and so we want to catch girls before they do that big growth spurt, because the growth spurt is when the
Exactly.
mild or medium curves can turn into severe, and the severe curves are the ones that can cause some difficulties.
That's right.
Bad, different aesthetics or even disability later in life. So we want to prevent that. And so if we can find patients that have mild curves before they're reaching their growth spurt, which is 11 for girls,
Isn't it
or
amazing how
12
young
or
it is?
13, then we can do something good for them by, I think,
But
preventing.
again, early detection is
Right,
the
and
way
there
to
was
go.
there was a swing away from school screening programs, and many of the schools around still do it, but it's not really a mandated thing anymore. So thankfully, most of the pediatricians are still doing it,
And
of
then they
course,
can send a referral to you.
Uh-huh,
And
and-
where can parents find you?
yeah, and parents can find me at our website, ocppc.com, or they can find me at any of our offices by calling our number, 561-967-6500.
With 3 convenient locations
Of
around
course,
South Florida
right,
to
right,
serve
right.
you.
Yes, yeah, Boynton Beach and Lake Worth, and I'm also in Wellington as well. And I'm at each office twice a week. I'm in an office almost every day.
2 beautiful state-of-the-art facilities. They
That's
are
right.
amazing. The Lake Worth office, I want to say but apparently it's been almost over 6 months, which
Yeah.
is amazing to
Wow.
me. You have a new
We're so
Boynton
thankful to be
Beach
there. It's
office
beautiful.
opening right on the Bethesda Surgery Center campus.
Yes, just within a few weeks or next month, we'll be
so
moving
you'll
to
be
a new
shifting your office
location
over there?
in West Boynton, which will be very convenient right off the turnpike, and it's going to be a beautiful new facility. We'll have everything there. We'll have full X-ray. We'll have patient,
good.
even special procedure suites, and we'll even be developing a surgery center as well. So
And you have MRI,
and of course,
PTOT.
PT and
Everything
MRI.
is comprehensive at OCPBC.
Right, right. We've
Amazing.
been working hard for that because we think we can provide the best care if we can fully direct the patients with therapy and keep them, in our house so that we know what's going on, and we can really. It's much easier to find out how they're doing see their images and review everything, and we can make things much more convenient for the patient.
So let me ask you this. If a child shows up to an emergency room, they could say, I want Dr. Ezra Berkowitz.
Absolutely.
Okay,
yes.
there you
And
go.
many of the emergency
Dr.
rooms
Ezra
know
Berkowitz.
who I am, and feel free to contact me. And
All
I'm
right,
always
awesome
happy to
sauce.
give advice. And most
Because that's where
often,
they usually wind up the first
yeah,
time.
unfortunately, yes. And thankfully, most of the things don't necessarily need to be managed on an emergency or immediate emergency
They can
basis.
triage and then
so-
call you,
Right,
call
right.
OCPBC,
Yep.
because it is comprehensive. And because you take birth to 18,
Right.
18, like we've talked about before, you talked about continuity of care. You do not age out of OCPBC. You
Right.
can continue
Of course.
and continue and
Right.
continue.
Yeah, yeah. And we all work very closely together. So,
Yes.
like, if there's certain things that we know another person does better or more often, then we always are happy to refer
That's
to
perfect.
each other. We love to communicate and collaborate and discuss cases with each other. And I think our patients benefit a great deal from that. It's more like a university type of thing.
I like that.
Fabulous. Thank you so much.
Yeah, my pleasure.
Dr.
Thanks.
Berkowitz, thank you. You can find Dr. Berkowitz and all of the physicians, orthopedic surgeons, physiatry, pediatrics, ocpbc.com, 561-967-6500. If you have any other questions, of course, always contact us on our website, twobroadsfromboca.com.
We're on Facebook. You can leave a comment.
Leave a comment. Chat with Dr. Amy. She's our big Facebook person.
I am the Facebook. I'm
She's the face of Facebook. She's the face of Facebook. And next week we have Dawn Masler, an author of fabulous book, Men Chase, Women Choose. Big topic. Love at first sight. Hormones. What happens?
I'm going to have two Dawns here and just me.
And I just want you to know, apparently, we are the prize.
Damn right about that.
Right? We are the prize. So thank you so much for joining us. It has been a pleasure. We'll
It
see
has.
you next week.
Thank
same
you,
time,
Ezra.
same
And
place.
thank you for having me.
Again, be kind to one another. Spread your joy. And
Yes.
just be Americans. Have a beautiful day.
Good night.
Bye-bye.
You've been hanging with the two broads from Boca.
If you have gained some confidence or an idea to create a better day, then we have made a difference.
Join us every Wednesday night at 7 p.m. on WWNN.
Give us a call, feel inspired as we continue to open those doors and have some fun.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.